I wanted to take a couple minutes and tell you about an experiment that we're doing that is the Dell Medical School. One of the biggest inertial forces in medicine is how we train doctors. We train doctors in organ systems and expect them to provide holistic care. We train doctors to be soloists and expect them to perform in an ensemble. And that can't continue if we're going to dramatically change healthcare. We need to change this in a way that we train doctors to think not about illness, but to think about health. And that is the fundamental aspect of the experiment of the Dell Medical School. Dell Medical School got its start back in 2012 in Austin, Texas. I don't know if there are any folks from Texas here. No hookums? Yeah, okay. That is a thing, by the way. If you go to the University of Texas, you do have to learn that this is the signal, or the symbol, or the whatever, the gesture. This is the Longhorns, that's the two. If you do unicorns by mistake, you get in a lot of trouble. I've been told. So Austin's the home of UT Austin. It's the flagship school of the University of Texas system. In 2012, we had a population of about 2 million people, making it the 11th largest city in the country, growing at a rate of 60,000 people a year, and that 60,000 person a year rate is continuing. Austin is now the 10th largest city in the country. But in 2012, Austin, with all of these attributes, had no medical school. And so the community got together and started to think about that. The partnership is really an important aspect of the Dell Med experiment. Texas is not a Medicaid expansion state. Care for, or the funding for people who are indigent or underinsured comes through health districts that are organized at the county level. And so the university got together with the county, with the city, and with a whole bunch of other people and passed a referendum in 2012, a tax referendum to support the school. The referendum raised $140 million. That money gets sent to Washington and sent through the state and comes back as a little bit more than $300 million. $35 million a year of that money is dedicated to the support of the Dell Medical School at the University of Texas. With that money, we started the building of a brand new school. It's a little bit hard to see in this picture, but you can actually see the Capitol Dome. We're that close to the capital of Texas. And the important thing about the way that the school was funded is that we started with this goal to change the way that we train physicians, but we also started with a commitment to improving the health of our community, of our neighbors. So every day we go to work conscious of the responsibility to improve the health of our neighbors. And that's a really different mission than I think most medical schools have. The goal of the school is to create doctors for Central Texas. This is our first class. They started in July of last year. It's 50 students selected from a pool of 5,000 applicants, immediately vaulting Dell Medical School into at least on that basis, the most selective school in Texas and one of the most selective in the country. The students are selected in a new kind of admissions process that includes things like the standard interview, but we also do 5 mini interviews with teams of people from the community so that we can evaluate these students not simply on the basis of are they smart, and they are wicked smart, but are they empathetic? And are they respectful? And can they work well on a team? We actually select students on the basis of their agreeability, as well as all of these wonderful characteristics about their brilliance. Educational inertia is really strong. Our goal was to train a new kind of physician, but we wanted to do that in an accredited medical school. And so we had to do our training without actually making it look different, because if you try to do it differently, it's really, really hard to get accredited. So we have a 4-year program. In the first year, Essentials takes a 2-year science curriculum and puts it into an incredibly intense 12 months. In our second year, we focus on delivery. The students are in clinical rotation for the entire 12 months of their second year. They go through at the hospital, out in the community. They go to psych hospital. They do a tremendous amount of stuff. Third year is the growth curriculum. We offer a number of different one-year master's degree programs, including, starting in 2019, a master's in value-based healthcare that will be offered through the Value Institute. And then in their 4th year, they go through the exploration, deepening their expertise in a particular area, also working on applying for their residencies, which we are hoping they will all land. The second aspect of our academic medical center is care for our community. And we've done that in a different way. We're focusing on care gaps. We're looking at areas where there is a big gap between what we know can be achieved in healthcare and what we're actually achieving in Travis County. So for example, in Travis County, we have 3 times the national rate of mortality from cervical cancer. That's clearly an area where we can focus and we know we can make a difference. The clinical care is being delivered through integrated practice units. This is the model articulated by Elizabeth Teisberg and Mike Porter in 2006 in Redefining Healthcare. The essential feature of the integrated practice units is that they're organized around a set of medical circumstances, not around how doctors are trained. So our initial efforts will be in joint pain. So we're not orthopedic care, we're actually treating people who come in reporting that their knee hurts, their hip hurts, their back hurts, their shoulder hurts. We're treating women with complex gynecologic issues. We're doing cancer, we're doing dementia as sort of the initial forays into the integrated practice units. Now, the integrated practice units are organized around a set of medical conditions, and that care is delivered by an integrated team that is co-located and works together through the full cycle of care for each of those patients. Most importantly in that is that we're measuring the outcomes that matter most to each patient at each encounter, and we're taking that information and feeding it back into our care paths to improve the care delivery that we're offering. So one of the hallmarks of the Dell Medical School is if you have that logo on your white jacket, you are measuring outcomes that matter to each of your patients. Finally, we've structured the organization of our research differently to achieve a different set of goals. Our goal is to transform care delivery. We're not a basic research institution. And so part of the difference is the organizational structure. We've actually created a department of public health with a department chairman with full status as a department chair. Those of you inside academic medicine know if you ain't a department, you ain't nothing. And we've created that for public health. We've also created the Value Institute for Health and Care that Elizabeth talked about a minute ago, geared and dedicated toward improving the delivery of high-value care. How do we actually implement value in healthcare? We also have a Design Institute for Health that's implementing human-centered design across the entire enterprise. Our focus is on changing service delivery. And so all of our research emphasis, or nearly all, is translational as opposed to basic science. And our goal is to create new care paths and care delivery models and then export those, help other people to see that there are these new models and new ways of delivering care. This is the University of Texas campus. We're actually down on the far right corner out of view of this, but this is walking distance from all of the venues of South by Southwest, and it's a short ride Austin, because in Austin we don't like Uber. It's a short ride Austin up from the Austin City Limits venues. So if you are in Austin and you'd like to see a new model of care delivery, we welcome you. We'll be glad to give you the nickel tour and show you around. And you can reach me at this. Thank you.